Hello, this is Sudharshan, and in this episode, PA 24.1, we will talk about oral cavity and salivary glands. So, a very important disease of the oral cavity is oral carcinoma. As the name itself suggests, it is a tumor that arises in the mouth or oral cavity. And coming to the incidence, starting from the lower lip to the palate, it decreases. Right, and this is very common in men who are of middle aged. And coming to the risk factors, for this we'll have a mnemonic path lab. P for Plummer-Vinson syndrome, A for alcohol, T for tobacco, H for HPV, human papilloma virus, especially the 16 and 18 ones. L is leukoplakia, where there is white colored plaques. A for asbestos, which is an industrial pollutant, and B for bad oral hygiene, like not brushing the teeth properly or not cleansing the mouth or consuming substances like gutka, pan or any other inhalational substances. And coming to the clinical features, mainly there will be white plaques which may be sometimes red and cannot be scraped off, and generally asymptomatic. There will be burning sensation, pain, tenderness, lymphadenopathy will also be there. And coming to the diagnosis, imaging techniques can be done like CT, MRI, and also a physical exam where we can see, as I already told, we can have the unscrapable lesions, red and white. And coming to the treatment, it will be surgery, also chemo and radiotherapy might be done. And coming to the gross and microscopic findings. So in gross, there are 4 important types of squamous cell carcinoma of the oral cavity: ulcerative, verrucous, nodular, and Schirrus. Ulcerative, that means there is a damage to the epithelium. The oral cavity is lined by stratified squamous keratinized epithelium. And then verrucous, which is also called papillary, where we see the folded epithelium that looks like finger-like projections or villi. And nodular, where we see nodules or bumps will be there. And Schirrus, where we'll see a flat surface. And microscopically, there will be dysplasia, where there is disordered cellular growth with the invasion of the tumor cells. And also a very important central keratin pulse will be observed. And also there is excessive keratin deposits or hyperkeratosis. Now coming to the disorders of the teeth, importantly we have dental caries. So with respect to the dental caries, as the name itself tells, it is nothing but the cavities that accumulate in the teeth because of acidity. And coming to the causes, the streptococci and lactobacillus are the main causes for dental caries. And when it comes to the risk factors, poor oral hygiene, any disorders, commonly Sjogren's and diabetes. In Sjogren's, where the mouth will be very dry. And when we come to the pathology or the pathogenesis, so how it occurs. So 2 phases will be there, that is dental caries and periodontal abscess. And when it comes to the dental caries, first there will be destruction of the enamel, that is the strongest protective layer of the teeth. Then there is pulpitis, the inflammation of the pulp, where there will be inflammatory infiltrate with discharge of pus that will affect the surrounding neurovascular structures. Also that bacteria, as I said, the streptococci and lactobacilli will be deposited there. And also the apex, that is the root part of the teeth, consisting of the root canal and the mandible bone. There will be inflammatory infiltrate, and that will spread to the entire teeth, and as a result, clinical features, there will be Tooth pain will be there with consumption of the food, and also removal of the tooth also sometimes will be there. That is a tooth collapse, I can say. And coming to the diagnosis, we can have imaging will be there, and on physical exam we can see the discoloration of the teeth that is there. And treatment will involve surgery and antibiotics to fight the infection. And prevention, it's a bit of common sense, like not consuming much of the sugary food, because that is the main cause of dental caries. And on microscopy, we can observe, very importantly, chalky white spots, on gross we can observe chalky white spots which are there in the teeth. So that is important. And lastly, let us see some diseases associated with salivary glands, out of which first we'll see pleomorphic adenoma. So this is a condition which is a tumor of different shapes and sizes. So basically it is a mixed tumor, I can say. So grossly we can see the tumor which is well circumscribed, and mostly we can see it next to the junction between the parotid region and the auricle. A very nice circumscribed tumor can be seen. And microscopically we can observe the the pseudocartilage, the false cartilage can be seen, and the proliferation of the ducts, excessive amount of the ductal tissue will be present. And coming to the prognosis of the pleomorphic adenoma, it is challenging. Treatment would mostly involve surgery. And finally, coming to Warthin's tumor. So Warthin's tumor is also called as papillary cyst adenoma lymphomatosum. As the name itself tells, papillary is folding of the epithelium, cyst will be there, enlargement of the tumor, that is adenoma, and also there will be abnormal amounts of the lymphatic tissue. Sometimes even lymphadenopathy, the enlargement of the lymph nodes can be seen. So Warthin's tumor is also called as papillary cyst adenoma lymphomatosum. It is very common in males who are mostly in addictions like smoking, tobacco, alcoholism. And clinical features, mostly on physical exam we can see a palpable mass in the mandibular angle. Next to the angle of the mandible there is a palpable mass. It's different with pleomorphic adenoma, which is more close to the auricle. And there are some risk factors like age, being Caucasian. So being Caucasian also is another risk factor, and male. And coming to the diagnosis, we can go for a biopsy. Two important findings: lymphoid stroma and epithelial parenchyma, where there is a folding of the epithelium, and glands also will be there, excess of lymphoid tissue as well. And and then coming to the treatment, it will be surgery, and the prognosis is good when diagnosed early. So that is all about the oral cavity and salivary glands. So thank you so much. We'll see you in the next lesson.